So, what I wanted to talk about was what I was going to talk about yesterday. So, first time I've ever trialed this, I'm going to do 2 videos back to back because I missed yesterday and I wanted to make sure that I actually talked about this because this was something that I wanted to do the video about yesterday, but then never did it. I never did this video yesterday just because, like I said in the previous video that I've just done, I decided that yesterday was all for me. And I just took the time to look after myself and do what I wanted to do yesterday. So like I say, I just did my workouts, we went out for lunch, we went out for breakfast, we bought a new coffee machine. We just did stuff that we wanted to do. Me and my partner managed to actually finish some of my receipts for some other stuff. But we just basically did what we wanted to do. But what I wanted to talk today was, or what I wanted to do yesterday, which I never did, was talk about proper planning and scheduling. As chiropractors, we maybe have a little bit more sense of direction than other professionals. So my experience with going to see other practitioners, by the way, because I see other practitioners and I find it really interesting because obviously as a practitioner yourself, you question other people's methods, and it's not everybody's method. Everybody's method is whatever they want to do. But my experience is, say for example, with massage therapy, that you will go to see a massage therapist, you'll go and have a session with them, and then you get to the end of the session and nothing comes from it. There's no, okay, look, this is what I think that we should be doing, and I'd like to see you. There doesn't seem to be an awful lot of that. And so there's no measurement at the beginning, there's no plan of action, and then there's no measurement again at the end. So the only outcome that you have based on that type of therapy is a sense of feeling. Now, as a chiropractor, I personally know that that's one of the worst outcome measures that we can have. Now, don't get me wrong, I use pain as an outcome measure with all of my patients because at the end of the day, the majority of them are coming to me with a problem. And so we do use pain as an outcome measure, but if it's the only outcome measure that we ever use, then is it safe to say that potentially there things are improving through your care, but not necessarily changing the pain straight away? Because this is the thing, like, you know, we go to the gym, we put on the pain, but the thing hasn't actually improved yet. You won't see an immediate change. It comes over time. And so for me, this is probably the most important thing about chiropractic care is scheduling. We create a plan, we create a schedule, and we try to stick to the schedule. We keep within a time frame. We use measurements at the beginning, and then we use measurements at the end. And what we want to do is we want to actually track progress. Now, my experience is I've worked with personal trainers on a number of occasions, and I've had a couple of personal trainers where I go in, I'll have like an assessment with them, and they'll do a couple of bits. They'll see how good my flexibility is. They'll start putting me on a plan. And by the way, they'll book it week by week. And then if I can't do a day, then I miss a day. And it got to a point where I was maybe doing like a personal training where I wanted to be getting my targets and goals. I was doing 1 or 2 personal training sessions a week, and sometimes it was 1, sometimes it was 2, but there was no plan. And because of that, it never motivated me to really go and get to the next level. Now, don't get me wrong, really, really hard in the sessions, but there was no proper, it wasn't really being measured. I didn't really know what results I was getting. So I had the measurements at the beginning, and then we never had a measurement afterwards. So the only result I had was whether I felt like I was getting something good or getting something bad. And this was the same experience I had with the massage therapist. The only experience I had was, okay, did it feel good? Yes, the massage felt great. Okay, what's next? What do we do next? Where do we go from here? Whereas obviously for me, every single patient that comes through the door, what we will do is we will do their full initial examination. If we need to on that day, we also do x-rays, as well as any other history or digital posture analysis that we do on the first visit. Now, I take all of that information, I download it, I put it all together, and I will then give that person a specific recommendation based on the level of severity. So, for example, if I have someone coming in who's had a chronic problem for years, they may 3 times a week initially, and we would track that after 3 or 4 weeks. Whereas someone else might have a slightly less severe problem and we might only see them 1 or 2 times a week, and we might see them somewhere between 6 and 12 weeks. So it would be a different scale. But the thing is that both of those people know, okay, I'm going to be coming 2 times a week, I might be coming for 6 weeks, and then we're going to have a remeasurement and we're going to see what changes. And so those same results that we had at the beginning, they're going to get remeasured so that you can then set your new targets. Because the thing is when someone's coming in, someone will come into me and say, for example, I've got a shoulder problem. Okay, why is that shoulder problem a problem for you? Well, because it hurts. Okay, so what does it hurt when you're doing? Oh, it hurts when I'm brushing my hair or taking my bra off. Okay, so if we could get you to be able to take your bra off and your hair, like brush your hair without having any problems, would that be okay? And that's the thing, like people have got a problem, but they always have a problem that is basically creating for them. You know, having neck pain, most people can deal with neck pain, but it's when it inhibits you from doing something that you actually want to do. So having those targets, having those goals, doing those things, remeasuring, retargeting, keeping a track, keeping a progress is the best way to do things. Now, it seems robust and it seems expensive, but the reality of it is if you can get it right and you can actually plan it properly and schedule it properly and get everything together, and you have a before and after, and you've got an outcome and you know exactly where you're going with that, it actually becomes cheaper in the long term. Because what happens is if people drop in and out of care and they do like 10 sessions and then they drop off, and then 10 sessions and they drop off, the thing is they yo-yo. And if you yo-yo, you end up going through that acute intensive care over and over and over again. And actually, the reason why I say it's the most expensive is that probably one of the most expensive procedures in this country is hip and knee replacements at about £10,000 to £15,000 a pop. So if someone's having a low back issue that's creating a mechanical issue that actually irritates their low back and their pelvis, and they start to irritate those tissues and it results in a hip replacement, guess what? Chiropractic care was not expensive. So I would like you to think about proper care planning, proper scheduling. And by the way, this isn't just true for chiropractic care. This is true for training programs. You should be using measures at the beginning, the end. And by the way, if you don't use a calculator, you can get the apps now for your phones, but track your progress. Same again with your diet. If you know that you're trying to lose weight, you can do the same thing with calories. You can track your calories this week. And then again, you can set yourself new targets. Now, if you've hit your target weight, you probably won't now need to be eating as fewer calories as what you maybe were doing before. So reset, rechange, retarget, reset, rechange, retarget, period of time, do the same again. Planning and scheduling, one of my favorite things about chiropractic care. One of my favorite things. I'm always planning, I'm always scheduling, and we always do progress exams and recheck after a certain period of time. It keeps me as a practitioner on target, and it keeps my patients on target because they can see the results. And results is what we want to see. Take care, guys. I'll see you tomorrow. Two in one morning. If you have any comments on any of these videos, please obviously just give us a shout. Equally, you can just leave us a message on our Facebook channel. Equally, you can jump over. We've got our YouTube channel and our podcast, which is Coffee with a Chiropractor. Again, that's with myself and many practitioners actually around the country. We've got about 20 or 30 episodes currently on iTunes and Spotify. So I'll speak to you guys again soon. I'll see you tomorrow.